Let's talk about the surgical process before, during, and after you undergo a joint replacement. So this is not just for office, but this is a typical course for any patient in the nation undergoing a joint replacement in the United States. So first of all, when you see us in the office, we're going to do a consultation where we can look at your x-rays with you, talk about what those show, then talk about your symptoms. X-rays do not drive surgical decisions. It's really all about the patient's symptoms and how much it's affecting your lifestyle. This is your body. You're the captain of the ship. We are just along for the ride and to provide some advice and potentially some options for you going forward with what's going on with your body. So when we talk about the initial visit, we'll see how things are going. We'll talk about whether or not we can try to treat your problem with non-operative techniques. That would be possibly physical therapy, strengthening around the joint that's affected. We could talk about potential injections with anti-inflammatory medications. We can also talk about oral anti-inflammatory medications. We could even talk about a non-operative treatment, which we have partnered with recently called ortho laser. The laser is a non-painful but penetrating laser that goes into the soft tissue. It stimulates the energy particles within the cells of the body called ATP. The ATP then sparks the cells to start the healing process in a more quick and rapid manner. And so this then allows the tissue to heal in a quick fashion. It also stimulates fibroblasts, which are the scar healers, to start to form scar, but then also to get softer in a much quicker manner. So the ortho laser is used for non-surgical problems as well as after surgery. When we talk about the actual process of surgery, so let's talk about before surgery, like the week leading up to it. If you come and you talk to us and you end up having surgery at the Louisville Hip and Knee Institute, we highly recommend you sign up for our text messaging service, which allows for frequent reminders before, during, and after surgery for different aspects of the recovery process. Before surgery, you'll get reminders that will tell you to put the ointment into your nose. In the Ohio Valley area, lots of us carry Staph aureus, which is a bacteria in our nose. Most likely that's due to the high allergy content that we have in this region. But we ask everybody to put ointment in, which is an antibiotic ointment for the first 5 days before surgery. We also ask the patients do specific soap cleansing baths and showers, and so we'll give you more detail on that before surgery. The day of surgery, you'll come to the surgery center, you'll check in, you'll be there for about 6 hours on average from the check-in process. Then our nurses will put an IV in, then our anesthesiologist will come talk to you, the surgeon will come talk to you, and then typically a nerve block is done before surgery so that you're more comfortable after surgery. We try to do all of our surgical procedures under spinal anesthesia. That's where an anesthesiologist will numb up the skin underlying the lumbar spine and then safely place a needle into the spinal canal, similar to a lady having a baby that has an epidural injection. The spinal then numbs the patient's legs from the waist down. It's a very short-acting spinal anesthesia, so it lasts for 2 hours on average. Then in the operating room, you go to sleep, but you do not get general anesthesia. There's typically not a tube down your throat that helps you breathe, and you get very light sedative called propofol. This is what people get for colonoscopies and sometimes dental work. That way, when you wake up from surgery, you won't have that general anesthesia hangover where you feel confused and disoriented for maybe even multiple days, as well as you're breathing on your own throughout your whole procedure so that it's a quicker recovery. If you really look at the data, the spinal anesthesia also helps with pain control after surgery, as well as it minimizes some blood loss during the surgical procedure itself. So we're big proponents of spinal anesthesia, and it has become the gold standard for joint replacement in the United States. Once you have your surgery, typically a primary joint replacement, meaning a hip replacement, knee replacement, partial knee replacement, those procedures typically take about an hour once everything is completely ready to go in the operating room and you're completely asleep. You will then go back to the recovery room where you'll wake up. Then about an hour to an hour and a half after surgery, you'll be awake enough to where you can start to walk with our team. Our recovery room nurses will have you up walking with a walker. And then typically about 2 hours after surgery, patients are stable enough to get in their car and get home safely with whatever family member or friend is picking you up from the operating room. Then we have therapy come see you the next day at home. It's home health physical therapy, and they'll work with you on a walker initially, and once you're stable enough, they'll get you to a cane, and then walking without the cane, hopefully soon thereafter. Typically, for our partial knee replacements, you're usually on the walker for 2 or 3 days and then onto the cane and then off the cane in a couple weeks. Full knee replacements take a little bit longer, so maybe on the walker for 4 or 5 days and then onto the cane for 3 or 4 weeks. Hips are very similar to partial knee replacements, where typically on the walker for a few days, and then once you're done with the walker, maybe onto a cane briefly, but maybe walking on your own. Typically, if you have surgery on your non-driving knee, that's the left knee typically, unless you have a clutch, which not too many Americans have nowadays. But if you have surgery on your left knee, as soon as you're off the walker and only using a cane and not taking pain medication in the morning, I think it's safe to drive. So sometimes that's a week, sometimes that's 2 weeks. If it's your driving knee, typically that's 4 and up to 6 weeks before you can drive again, just because it's your driving knee. And if a child runs out in front of you or a big truck pulls out, you'll need to stomp on the brake as fast as you can. Hip replacements, maybe similar to the partial knee replacements, where potentially maybe even in a week or 2 you could be driving. But we just want you to be safe. We recommend acting like a teenager again, taking a couple trips around the block just to make sure you're completely safe with a family member. And then once you are, then you can start driving again. The recovery for the first 24 to 36 hours after joint replacement, typically there's not a lot of pain. That spinal anesthesia really works quite well as 2 different nerve blocks around the knee before we do a partial or full knee replacement. We also do peri-articular injections while we're working on different body parts. That means that while we're doing a hip replacement or a knee replacement, we'll actually inject a combination of different medications into the tissue around where we're working. Some of those are numbing agents, some of those are anti-inflammatories, so that helps with the pain after surgery. Typically that stuff wears off in about 36 hours, and then day 2 and day 3 are the most painful. So our recommendation is you get home from the surgical procedure, get comfortable, and before bed, even if you're not hurting, we recommend you take a pain pill. Typically that's oxycodone or Percocet, which we will send in before the surgical procedure, typically about 4 or 5 days before your procedure. I would set an alarm and take one every 6 hours, and I would do that regularly to stay ahead of when those nerve blocks wear off. If we can stay ahead of that initial pain surge, we're way ahead of the curve on the healing process. Typically, people are back to walking in the neighborhood for a little bit of exercise 6 weeks after a knee replacement or a hip replacement, and then it's 3 months before we really recommend walking a couple miles or going for a hike in the woods. And then if you're a pickleball or tennis player, typically that's about 6 months before we recommend getting back to doing that kind of activity after a knee replacement. After a partial knee replacement, that can be 3 or 4 months before you're back to playing pickleball or tennis. So if there's any more questions about the recovery process, please call the Louisville Hip and Knee Institute and schedule a consultation at your convenience. Thanks and have a good day.